Hello everyone. Today we are going to talk about the basics of heart failure. Now, heart failure is commonly called CHF, and the C stands for congestive heart failure. First, in the chest here, we have our heart, and as we work our way down through, we're going to kind of peel these layers back. And this is what the heart would look like if you remove the breastbone and the ribs. You'd be looking at the heart like this, and it has its outer covering with its external arteries and kind of the covering of your two atria and your ventricles, and then you can see the great vessels coming out of the heart here too. So if we were to get rid of this top layer, we kind of go deeper down into our heart here. We can a little more easily see the chambers of the heart, and of course there's blood still flowing in those great vessels, but if we get rid of that blood too, we kind of end up with something that looks like this. And this is a good picture, I think, of the heart that shows us the chambers inside of the heart, and it's easier for us to kind of see what's going on deep down inside. So if we're talking about the heart here, let's just go through our anatomy first. The heart is divided into four chambers. You got your left atria and your left ventricle. Same goes for the right. You have your right atria and your right ventricle. Let's understand the general flow of blood through the heart. And why don't we start with some oxygenated blood from the lungs enters into the left atrium here. And then it is transported down here into the left ventricle. And from the left ventricle, the blood is pumped out into the aorta and into the body. And every organ that you can think of in the body is going to have some blood pumped to it. So I think up here we got our brain. So our heart pumps blood to the brain, and it pumps blood to our face, and it's going to pump blood over here to our upper extremity. And then the blood that is pumped down goes to our lower extremity, as well as all the organs in our abdomen. So our blood is pumped everywhere in the body, and that's oxygenated blood. And then all those organs use up the oxygen and pump blood back into the heart through our inferior and superior vena cava. Into our right atrium, blood is then taken down into our right ventricle, down here, and pumped out into our lungs. So we'll go over here and we'll say lungs. That's the general flow of blood through the heart. And if you think about heart failure and congestive heart failure, it is just a backflow of this flow through the heart. And if you have a traffic jam, so to speak, blood starts backing up in this closed circuit, and that's what ends up leading to all of the signs and symptoms that patients experience when they have heart failure. So now that we understand the anatomy and the flow through the heart, we can start talking about what causes heart failure. And if we think about that flow, the heart really only has two functions. And its two functions are to, number one, pump blood. And this is called systole. And the second function of the heart is to relax. So it needs to be appropriately elastic in order to fill. And what's going on at this time is called diastole. And that's it. Those are your two main functions of your heart. And if your heart can't do one or the other of these two, that's how you end up with heart failure. Now, if a patient comes to a doctor and says that they have symptoms that are concerning for heart failure, how are they going to figure out if someone has heart failure? Well, the thing they do is they do an ultrasound, or what is called an echocardiogram. And an echocardiogram is just a fancy ultrasound that is able to take a good look at the heart and classify how well your heart is pumping and how well your heart is relaxing. So over here, kind of have a picture of it. Think of the heart sitting on its side over here. You have our echocardiogram. It's really just an ultrasound probe that goes through there, and it shoots a nice little sound wave down through here in this kind of fashion, and it's able to watch it squeeze in real time. And what we do with this is we quantify heart failure with what is called an ejection fraction. An ejection fraction is just the percentage of blood that the heart is pumping with each contraction. And the ejection fraction, it's important to understand the percentages. And with an ejection fraction that is greater than 50%, that is normal. When someone has a pump problem, or what's called systolic heart failure, their pump is not functioning correctly, and it's not having the same adequate squeeze or same ejection fraction as someone with a normal heart. So with systolic heart failure, our ejection fraction is less than 50%. And if this pump over here, this muscle that I have drawn here, is not functioning correctly and it's got a weaker squeeze, we're not pumping as much blood out here into the aorta, and not enough blood is going to get to the brain, the face, the arm, the legs, and that's going to lead to a backflow of fluid back this way, back the opposite direction, because it doesn't have the strength to pump out any longer. And that leads to a chamber or a left ventricle that just dilates open because it has too much or excess blood in it. So this gives us a dilated heart. And that's what you have when you have systolic heart failure. So someone goes to the heart doctor, they look at the ejection fraction, they calculate it, it's less than 50%, and they give them a label of systolic congestive heart failure. Now, on the other hand, we have diastolic heart failure. So as I mentioned earlier, when the heart needs to relax and fill these chambers with blood, that's diastole. And sometimes the heart muscle gets very stiff and it loses its elasticity. And when it loses its elasticity, it can't fill as well. So when it can't fill as well, we have the same problem. We have less blood volume in this chamber that is able to be pumped out, which leads to that same backflow of fluid. So this is diastolic heart failure, but we don't have a problem with pumping. We just have a problem with relaxing. So diastolic heart failure is often termed heart failure with preserved ejection fraction. So based on that, that's pretty self-explanatory. Our ejection fraction is normal. And we don't have a problem with getting too much blood in the heart. We can't get enough in there. So we don't have the dilated heart. We have a less dilated heart. And that's really it. Those two functions make up how our heart beats and pumps blood everywhere. And if you understand that if you fail in one or the other or both of those functions, you lead to this backflow of fluid and vascular congestion. And you have the lack of good oxygenated blood pushed to your legs, to your organs, to your brain, to everywhere in your body. So I think the last thing we probably want to talk about, what causes heart failure? And causes are kind of the same as risk factors. And really you can divide your causes and risk factors of heart failure into two broad categories. Over here we can think about what's called ischemic. And ischemic just means the lack or decreased amount of oxygen. And things that cause ischemic or ischemic causes of heart failure are myocardial infarctions or heart attacks, and the pathology that leads to those, which is coronary artery disease. And then the other broad category that we have, if we have ischemic over here, we can think about these as non-ischemic. And our non-ischemic causes are really just diseases and pathology that lead you to be more likely to have ischemic causes of heart failure. And the ones we're talking about here are high blood pressure, high cholesterol, diabetes. DM stands for diabetes mellitus. And then you have some other causes such as, let's say, toxins. And when I think of toxins here, I'm talking about alcohol, if you drink enough of it, and some drugs like cocaine. And less common in the developed world, but more common in the developing world, we actually have viral or infectious causes. In the developing world, it's a little more common to get things like viral myocarditis and infections like tuberculosis and systemic infections that cause heart failure. And then one final one to think about here that's a little bit unfortunate, it's kind of in its own category here, is some people are just born with bad hearts and they have what's called a hereditary cardiomyopathy. And right here, it's really important to think that these top three that we listed on this chart actually are the three leading causes and risk factors of coronary artery disease, which then in turn leads to heart attacks. So you have your causes and risk factors of heart failure in general, and then some of those risk factors lead you to have this coronary artery disease, which in turn can also give you heart failure. If we understand the basics of this, it makes understanding the signs and symptoms that a patient will present with much easier.